Thompson.
I didn't catch the voice, you know.
You didn't get a voice today.
Dr. Thompson, Happy New Year, good afternoon, and welcome back.
Oh, happy New Year to you, Mr. Cameron. How are you?
Over here.
Right. Any exciting news for the new year?
Well, I'm alive. That's exciting.
Well, that's the most exciting thing.
It's exciting. You're alive. Yeah.
Yes. So, well, definitely, by God's grace, we are about to start our year off as we normally stay with a bang, right? But we have some news that we'll give to persons. It may be some sad news, but not really sad, because we're gonna work on upgrading the place a bit, and that's intrinsity. All right. So I'll get into that. Of course, I have with me this afternoon Mr. Diaz as well, and I know that he just sent me a nice little testimony there. So I know that actually would have actually made him really, really excited for this afternoon program. Now, this program just going to start off the year, a new year, new you. So that's the topic, right? New year, new you. Okay. For 2024, because we have seen so many persons coming in with either things like cancer, diabetes, heart disease. Cancer was actually number one on the list when persons were actually come into the clinic. It seems like this is something, as I said in a previous show, that this is something like it's becoming like the common cold, So we want to really be mindful of the prevention of these things. And once we are able to prevent the problem, then we don't have to, be looking for a big cure. We're always looking for a big cure in the science world. But sometimes, God would have given us simple remedies that maybe be able to alleviate certain problems. Now, we cannot even say the word cure itself because it's a forbidden word. We sometimes we cannot even say certain words as reverse because those are forbidden words in the medical system. Well, I put it down that way. But what I would say, what we have here at the clinic is to help persons, is to help their body to heal itself. And that's what we're going to more or less focus on. So just being truthful, the body has the ability to heal itself, and it does a marvelous job of healing itself. So before I move forward into introducing Eden Heights Clinic to persons that would have joined us back then and would have also joined us in 2023, and of course starting off the new year, let me just let Mr. Diaz come in and he'll share a few words, and then we'll get into the meat of the program here this afternoon.
Hey, well, good afternoon, Dr. Thompson. All right, it's nice to be here. Interestingly, as you just, the circle words, you just can't use anymore, as you just said, cure. But Dr. Thompson, the scientific word is correct. It's not as if we could cure anything. We really can't. So I have to agree with them there. But you hit the nail on the head. Yeah, you hit the nail on the head when you said that, God has actually built these bodies with the ability to heal itself. As long as you give the body what it needs, then the body can heal itself. So, they are correct. We are not able to heal anything, and neither are we taking any credit for healing anything in the first place.
Amen.
But it is good that we understand, and we get more understanding on a daily basis how God have created these bodies. And as a result of that, we can use that to our advantage, because all we need to do is basically, again, bring the body back to the original, or, bring the diets back to the original and allow the body to heal itself, So I would definitely like to agree with you there on that one.
Right. So, of course, Cameron, I know that, you might have your New Year resolution, and most persons will have resolutions. And, the first thing that sometimes comes to mind
Yeah.
It's okay, I want to lose weight. Because you know that you have eaten so many different types of foods that persons would have gained so much pounds, and they would have been having so much fun throughout the little holidays. I just find it actually passed pretty quick when you really think about it. But you know, for our sake, you know, God will have to shorten the days, because you're looking at what is happening in our little country, so much murders and different things like that, so much negatives that has taken place. But today we bring a positive in that Eden Heights Clinic has certain services that we offer to persons that they are able to use at their leisure to help to overcome certain problems, so that they'll be able to get their health back on track. So we want to make health in 2024 very interesting. Interesting meaning in a way that person will have at their reach everything that they need to get themselves well. All right. If you notice, the words get themselves well. So in other words, you will get the information from us, but you have to make the effort. You have to put in all the effort to actually get yourself back on track. So, you know, I just want to look at some of the services that we tend to offer at the clinic. And these are services that will get you into a new life itself, a new change in the human body. Everyone loves to feel healthy. Everyone loves to feel energetic as well. A lot of persons that I would have met last year would have been having trouble with energy. This is something that definitely we will be looking at this year. So we offer to persons at Eden Heights Clinic, number one, healthy solutions for lifetime. Okay, and some of our services here would be consultation. Of course, this is one-on-one speaking with either myself, Mr. Diaz, Dr. Navarro, and then we have the live blood analysis, which is a simple sample of blood taken from the individual. Of course, as placed on a slide, is looked on a screen. And what we look for is if there's any early signs of health complications for like circulation, immune system. Some person may come in and they might have little parasites, you know, they may having knee pains, back pains, hip pains. They basically want to do treatments like what we call prolozone therapy to help with that. Colon hydrotherapy, but as a particular treatment that is actually used, especially Mr. Diaz, persons would have gone through the festive season where they would have eaten so many things, especially down to the cakes and the sweets and different things like that. And of course, this is a therapy is getting rid of wastage from the colon, okay, or feces from the colon that, you know, you might have left back stuff there from since, or residue from since back then. Some person would have gone through constipation or forcing to go, and you would need a little remedy for that. Well, at Eden Heights Clinic, we definitely have remedy that persons can actually appreciate. Limb bagging for all things like diabetic sores, ulcers, oxygen bath. We have so many persons that are having pains in the hip, pains in the back, pains in the knees, pains in the ankle, just sometimes pains across the chest. This particular therapy actually works pretty good for that. Athletes, if you're having trouble with healing, okay, at Eden Heights Clinic, we have therapies that you can use to alleviate those long-term injuries that you would have had from since back then. So I just want to give out the numbers so that persons could actually get on to us at Eden Heights Clinic. Our number to call will be 493-9196, 493-9196. And also they can call Shaguana's number at 613-7571, 613-7571. Of course, there are persons that are logged on Facebook and also, of course, our Instagram and the YouTube as well. So if you want to get us on YouTube, Instagram, and also on Facebook, you just type in Eden Heights Clinic and you'll be able to find us. So that number again, 613-7571. Okay, so Cameron, just want to bring in Mr. Diaz again. So Mr. Diaz, what it is at Eden Heights Clinic? What do we have planned for persons for 2024? Okay.
Well, again, there's a number of things that we do have planned. After having, various sessions of consultation among ourselves, at the Eden Heights Clinic, one of the things that we want to do there really and truly is to the best of our ability, make health affordable, for as many as possible. All right. We know that things are expensive. It's not getting any cheaper. When you take a look at the price of importing stuff, we know that, all of these prices are going, nothing is cheap anymore. But of course, we have the advantage of being able to use what is locally available to us. Myself as a herbalist, of course, I am always on the research for stuff that is available locally. So here at the Eden Heights Clinic, that is one of the areas that we are definitely or constantly basically looking into. All right, we want to be able to step up on our cancer protocols. This morning, I had a chat with one of the clients there. Well, as Dr. Thompson was saying, she was a little disappointed. Why? Because of the fact that before the Christmas season, she started her treatments and everything, and she was really happy, because she was getting some really nice results and everything. And I suppose she sort of missed the mark a little bit over the season because she found herself indulging in stuff that we had asked her not to indulge in. And as a result of that, she came this morning and she says, I feel a little disappointed because some of the great results that I was getting, starting to feel as if, I started to lose that because of certain things that started happening again that had actually stopped. Of course, what I was able to encourage her and let her know, hey, hear what's going on. You got off the horse a little bit, but guess what? Don't let that beat you over the head. All right, you know what you have to do. Let's get back on the horse. Let's go again. But it's really important that people need to understand that health does have a cost, and I'm not just talking about money. Of course, yes, it does cost where money is concerned, but health has a cost because it can cost you more than money. It can basically cost you your life. It can cost you, the ability to get up on a morning feeling healthy and strong. It can cost you the ability to walk, something that so many of us take for granted. So we do understand that there are challenges as far as staying healthy is concerned. And as I mentioned before, the Eden Heights team, we sit down, we speak about these things, and we definitely in 2024, we want to find a way, of course, to help as many as possible in various ways. So nothing is staying the same here at the Eden Heights Clinic. There's a lot of consultation going on among ourselves. We are definitely trying to put our best foot forward, to accommodate everybody that actually walks into these doors. So it's a lot to say, it's a lot to think about, but nevertheless, by God's grace, we believe that as time go on, that as we put our various expertise together, we are coming up with a program that, by God's grace, that will be second to none, pretty much in this country. So lots to talk about there, Dr. Thompson. Lots to talk about, but we are definitely trying our very best to try to put things in place as much as we can.
Yes, well, of course, Cameron, we definitely have a lot to offer to persons at the clinic here. Many persons would have passed through and you know would have come from time to time. I remember a lady, she actually came today, and she was like, "You recognize me?" And I'm like, "You know, I do recognize your face, but I find you look shiny. I find, you know, there's something different about you." And then she spun around and she was like, "Yes, I feel so energetic. I feel a difference. Now I can actually sleep. I can actually move a little more, you know." So these are things definitely we would like to hear from each patient that comes into the clinic or client that comes into the clinic, that, you know, stay with us. Many of them actually become family to us, so that, you know, we have this one-on-one talk with them. Some persons just even come into the clinic just to sit down sometimes and talk, and you know, because they feel at home. I know a lot of patients who actually do that, who sometimes, you know, they come up to you and they ask them, "Okay, what you're here, what brought you here today?" And they're like, "Okay, I just wanted to come and just say hi to everyone, see how everyone is going. I'm doing pretty well, and you know, by God's grace, we have definitely seen results for persons." There's a lot of persons that are having trouble with arthritis, diabetes, heart disease. There's a lot of persons that are having trouble with all sorts of things like joint pains, you name it. There's so many diseases that are actually arriving in our world today that sometimes you look at the name, you look at if there's any cause, they tell us that there's no cause. But in order, in my thinking, in order to name something, then there must be some type of cause. All right. Is it that we need to look deeper or go deeper into the understanding of certain things? And you know, the human body, even if I've seen persons when they come in, even if we don't know how to, let's say, not know how to, even if we don't know the real cause of the problem, I have seen persons sometimes just start making changes within their lifestyle changes, and somehow the problem itself just seems to go completely. So that's why we always try to point at the human body heals itself. You just have to give the body time, and it will actually do the job that it needs to do. So Cameron, at this time, maybe we can take, if there's any calls, we'll be able to keep the program a little interactive with persons. But before we go in onto those calls, just a reminder for persons, we are going to be closing down the Trinity office. Now that is just for renovation, so don't get any ideas. Don't get any strange ideas. All right. So closing down the Trinity office is going to be closed for renovations, and that will be starting on the 15th of this month. The 15th of this month, the Trinity branch is going to be closed for renovations. So I hope that persons who are listening don't just hear closed only. You hear the word renovation. So please, anybody that you know that is close to around you, share this message. They will be able to come down to the Shogunas branch, where the whole team is going to be there at the Shogunas branch. You know, sometimes, you know, persons will come in and they'll ask me for you, Mr. Diaz, and they'll be like, you know, where's Mr. Diaz today? I say, okay, he's at the Shogunas branch. Oh my, I missed him today. And then, you know, it might be the other way around. Where's Dr. Navarro? They're asking for him. So if you need to see every one of us, you'll be able to come down to the Shogunas branch, and you're going to see Dr. Navarro, you can see Mr. Diaz, you can see myself, and you can see the whole staff itself. So we are all going to be down there. Let me just give out the numbers so the persons could call, and then we will see if anybody has any particular questions that they would like to ask. So it's 493-9196, 493-9196. You can always also get us on 613-7571, 613-7571. So remember, you can ask any questions that comes to mind, any health questions today, and then from next week onwards, then we'll get back into some serious topics, health topics that persons will really appreciate. All right, so Cameron.
Great. So if you'd like to be part of the program, any questions you have, any suggestions, any comments you'd like to make, now is the perfect time to do so. 622-3937, the phone line are Good afternoon and welcome.
Good afternoon.
Good afternoon.
I would like to find out what is the difference between a blood analysis and the other one is
But the dry blood analysis and the blood analysis.
the blood analysis and the other one where you check your whole blood.
Doctor?
All right, so that's actually a great question. So the difference between a live blood analysis and also, well, as we normally put it, normal blood testing. Well, what I would tell you, we use both techniques to help persons to overcome certain types of health problems. Now, the difference is one, you're taking it from the fingertips, so it's a capillary blood sample. The other one, of course, you take it from the veins, and both of them are used to examine as to what's going on. There are a lot of persons that would have done normal blood testing, but they're having certain signs, symptoms. They are totally basically in pain and frustrated. And then their doctor is telling them, everything is okay, everything is normal. But in that case, when we see that, we will perform a live blood test to get persons to see, okay, we'll be looking at, okay, if there's any early signs of health complications that, that may have been missed by doing a normal test on a person. So with that, what that will basically show, if there's circulation issues, it goes down into a lot deeper information on nutrition itself and how food affects the body itself. So you're looking at a person might have fats building up in the blood. You might check your cholesterol. You may not be able to see the effects of what it does to those blood cells itself. So that's where the blood analysis comes in. You will also get to see where a person gets to see general for themselves. You will go into a doctor's office and he will give you your results and you'll go home with that. But without, let's say, deep and full explanation as to what is going on. Within a live blood test, we get to sit down with the patient one-on-one where we can have a good one-on-one talk and look at the blood. Both of us are looking at the blood, and from there, we get the idea of what taken place or what person might have missed within their normal test, which shows, let's say, it shows like a normal, that nothing is wrong with you, but then you're still in trouble of certain types of complication. This is where a live blood test will come in to help us, to give us some more information.
We have another call on the line. Good afternoon. Welcome.
What is the difference between a blood analysis
With the question?
What's
The compass assessment, I think that's from another program. And the blood analysis, doctor will explain this blood analysis for you.
the compass assessment?
Yes, he's signed up for that program. Yeah.
Okay, maybe it's another program that someone else did. Okay, right. But a blood analysis is a simple sample of blood taken from the fingertip, and that is actually shown on a screen, which is used to point out if there's any little early signs of health complications. That other test, I'm not too sure about it.
Test, you place your hand on kind of keyboard and it tells you everything that is going on with your body.
Okay, well, that's something we don't do at the clinic itself. Yeah, what we focus on is general blood test, and then we'll send persons for either X-rays, CT scans to get further information into it. I don't know if Dr. Diaz, Mr. Diaz would like to say anything on that itself, if he has any information on a compass. Okay, sure.
Welcome. Good afternoon.
Good afternoon, sir.
We need oxygen to the right, not to much of oxygen. Without oxygen, we die. So explain to me what is that anti-oxygen?
Right. What is an antioxidant?
Yes.
Is that the question?
Yes, sir.
Okay, sure. All right. So, Mr. Diaz, you can take that one, and I will share some more on it afterwards as well. Antioxidant.
Well, I suppose to make things simple, we can look at a simple vitamin that is considered an antioxidant. How about vitamin C? All
Mm-hmm.
right. So simple as taking vitamin C, that is considered an antioxidant. Now you have to remember that antioxidants basically helps to prevent free radical damage.
Mm-hmm.
And free radical, I'm trying to find simple ways to explain it so that I don't start to go down the road of rocket science. All right. So if it is that we are sticking on a proper plant-based diet, we don't have to worry about antioxidants. We don't have to worry about free radicals and stuff. All right, free radical damage is basically caused when it is that we start going outside the realm of a proper diet. All right, let's put it that way. If it is that we are eating properly, we resting properly, we drink enough water and good quality water at that, okay, we are not abusing the body. These are not things that we really need to worry too much about. All right, but antioxidants, simply to say, basically helps to stop or prevent free radical damage, all right, in the body. Okay, so all of this can be summed up again to understanding that antioxidants basically comes from, again, uh, proper treatment of the body, eating proper, all right, sleeping properly, having enough water, all right, by basically stopping the abuse pretty much of the body. These
Right.
these are the areas that we can basically help to prevent free radical damage, and this is another way of ensuring that we have enough antioxidants basically doing that job in the body.
All right. Yeah, well, definitely keep it as simple as possible. So for persons that are listening, of course, most persons will hear the word things like beta carotene, vitamin C, vitamin E. All of those are antioxidants that persons use.
They are more like substance that may protect yourself.
Yes,
Yeah.
yes, that's what antioxidants. Of course, free radicals.
Yeah.
Well, I know we may be out of time just now, but free radicals, of course, those are what comes in and cause total destruction to the cells itself, to the mitochondria of the cell. That's like the powerhouse. That's where we get our energy and those type of things. So to the caller, very good question, and of course, we know that by God's grace, if you want, you could actually go on our YouTube channel, Eden Heights Clinic. You'll be able to find some videos on information on that, or just do a simple Google what is antioxidants. So persons who don't know, who haven't heard the particular question, they could do their own research on that as well. Yeah.
Okay. Well, it's been great chatting. We're out of time once again. Of course, it's been great chatting for the new year, and we look forward to chatting with you again next Tuesday. God will. Any closing tip or advice you would like to share before we leave?
Yes. Closing health tip, of course, we're going to be down at the Chaguanas branch. The Eden Heights Twin City will be closed for renovation, and that will be starting from Monday onwards. By God's grace, if persons want to get on to us, they can call our numbers at 493-9196. They can also call us on 613-7571. So by God's grace, as we continue to share information, we'll be able to get that information out there so that person will be able to get better health in general. All right. So, Mr. Diaz, I don't know if you have any closing comments.
Yeah, well, Just like to share a little bit of that testimony that I sent to you there. All right. Just one of the clients basically sent me a message indicating that she was basically being treated for a cyst on the liver, but she also had hepatitis. All right. After she had done 2 months on the program, she basically sent me that message there to let me know that they weren't able to find anything. As a matter of fact, they weren't even able to find parasites in her system. All right, so hepatitis, gone. Cyst, gone. Parasite, gone. Fatty liver, gone. All right, everything pretty much that they were testing for in reference to her liver and blood and everything, clean. You know, so I was happy to receive that testimony a short while ago. You know, and of course, it was such a simple program, but nevertheless, by God's grace, she got fabulous results.
All right, blessings to you, Cameron, and I hope you have a blessed day, and of course, continue to have a good New Year.
Thank you. Same to you. All the best. Have a great day.
Okay, all the best, Cameron.